Previously, prenatal smoking has been linked to premature birth, underdevelopment, and asthma. According to a new study published in the journal JAMA Otolaryngology, a connection has been made between smoking while pregnant and hearing loss in adolescents. In a group of 964 children ranging in age from 12 to 15 from the National Health and Nutrition Examination Survey in 2006, kids with exposure to tobacco smoke were roughly 3 times more likely to have mild hearing loss, and kids without exposure were found to hear better by 3 decibels in comparison. But that's not all. Those exposed were also more likely to develop cognitive and behavioral problems and have lower IQs. Paige Holt, Doctor of Audiology at Lake ENT, explains how they test for hearing loss in infants.
With infants, we can't expect them to respond, and we actually like for them to be asleep or very still and quiet during the testing. And so we actually put a probe in their ear and put different sounds in their ears, and we're measuring an echo that comes back out of the ear. And we know that if the ear is healthy and developed like it should be, that we should get that echo. We'll know what pitch the echo should be and what volume it should be. And so that's what we're looking for. It's called an otoacoustic emission. That's how we test an infant. As far as children go, once they become about a year old and they're able to respond, then we will put them in the booth and play some sounds through speakers, and we'll watch their reaction. Their eyes may move, they may hold their breath. Sometimes they'll actually turn their head and find the sound, and that's wonderful if they can do that. We usually expect them to turn their head and respond right around that time, definitely by 2 or 3 years of age. So like I said, we'll have one person in the booth observing the child's response and the other person running the equipment on the outside of the booth. If a child has hearing loss, then it could be a temporary condition that can be corrected through surgical procedures. Maybe they need to have tubes placed in their ears, and that usually can correct that, and then they're hearing fine and everything is going to work well for them when they go to school. For children who have more of a permanent hearing loss due to birth or some other illness that they may have had, then we will start talking to the parents about how we want to rehabilitate that by use of hearing aids, working with the school systems to make sure that there are speakers set up in the classroom so that the child can hear the teacher and not have distracting noises.
For more information on the audiology services offered at Lake ENT, please click the Prenatal Hearing Loss Story Link icon on our homepage, yourhometownhealth.com.